At the just concluded 78th World Health Assembly in Geneva, Kenya's delegation played a pivotal role in shaping the global health agenda. From financing reforms to groundbreaking child protection initiatives, the permanent mission of Kenya demonstrated strategic leadership and a vision for Africa and the world.
I think having Geneva mission, Kenya Geneva mission here, is a strategic placement by the Kenya as a republic. It gives us a chance to be able to contribute to the global discourses. We always say diplomacy, if you're not on the table, you're perhaps on the main. At the moment, we're privileged, for example, to be members of the Human Rights Council as a country. So what better way to be able to champion Kenya's interest or national interest than to be on that particular committee when things are being discussed. So I think the strategic positioning of our national interests are best done in a dynamic environment that Geneva really offers to us as a country.
With a firm seat at the table of global advocacy, Kenya's mission in Geneva not only amplifies national interests, but also drives meaningful health reforms. At the heart of this effort is a bold push for sustainable health financing and global policy alignment.
After a lot of the funds were pulled out of the health industry by the US government, we suffered a huge shock as well here in Geneva. And everybody wanted to know, so how is the world refinancing? How are we making it sustainable? And for us, Kenya, we actually have a sustainable health system that we're trying to execute through our social health authority. Yeah. So we articulated that a lot. We had maybe 3 or 4 or 5 side events where we were talking about health financing. And that's really important for us because if we're at the forefront and we can be able to show other member states, not just Africans, but the world, what we're able to do to be able to make sustainable financing for us for health, then I guess we become a leader and authority in that space. We set the standard of what is good for Africa and what does Africa need. And it was great because, as you know, before the pandemic, Africa suffered. Yeah. We had vaccine inequities. We had no access to technology or even diagnostics or even the vaccine itself, right? So our work was to make sure that every gap that was identified during the pandemic is actually bridged. And Kenya was able to lead that discussion. We led, in particular, one article called Article 4, which is on pandemic surveillance, which means what are the standards we're setting in terms of collecting data in preparing for the next pandemic? How ready can we be? And that's what Kenya led. And we made sure that there's tech transfer, there's know-how, and then every pathogen we share, that we gain a benefit from it. And we also led to the discussions on what I said, the pathogen and access benefit sharing system. It's called PABS.
While the pandemic treaty was a critical highlight, Kenya also brought global attention to an often overlooked issue: violence against children.
We had another side event, which is extremely dear to me. It's called the eradication of violence against children. So corporal punishment is something that has never been abolished the world over, but Kenya has. We have our constitution that protects our children against corporal punishment, but we don't have that in all countries. So Kenya brought corporal punishment to the World Health Assembly for the first time ever in the history, in the 79 years of World Health Assembly. And we declared that violence against children must be banned. All forms of violence in school, in the homes, and also outside those facilities, right?
Ambassador Fancy Tor emphasized Kenya's pragmatic and innovative approach to solving global financing challenges.
Kenya, like many other countries, are very cognizant of the dwindling donor support. And one of the fronts that we've been very much affected is on our health engagements. But there are a number of things that as a mission we are strategically pursuing. For instance, we want to see whether we can get more innovative ways of handling some of these challenges. Some of them could be as simple as finding solutions from non-traditional donor approaches to the solutions that we have. We have, for instance, been able to have discussions with non-governmental organizations or the non-traditional donors who are willing to partner with us.
Despite financial constraints globally, Kenya's commitment to its international obligations has ensured its voice remains strong in the multilateral system.
Because of the global financial crisis, most of the international organizations are facing high rates of default from payment of subscriptions. Again, one of the things that Kenya does well, even with all the pressure that we have as a nation on our economy, we are in good standing in many organizations. That is not even a feat that the so-called developed countries can boast of.
Kenya's role at the 78th World Health Assembly has marked a significant step in asserting not only its national priorities, but also positioning Africa as a strategic force in shaping global health systems for today and for the pandemics of tomorrow. For Willow Special Reports, my name is Yvonne Kawira.